We're here today. Let's shift gears. Let's talk about healthcare. That's a big topic for business owners today. It's a challenging problem for sure. How many of you in the room recognize this guy? A few of you. Let me tell you who this guy is. Edward Deming. I'm in manufacturing. This is a well-known face in the manufacturing community. He's known as the father of modern-day quality control. What the heck does he have to do with healthcare? Well, in 1992, I went to a presentation in Detroit, being a second-tier supplier to Ford, and Deming spoke all that week about the quality control system that he had brought to Ford Motors. Ford actually hired Deming in the 1980s after the Japanese were beating up the automobile industry with superior quality and better costs. And at the time, Dr. Deming was 92 years old, and I did not know if he was even going to speak at the conference. They wheeled him up in a wheelchair. He stood up and he talked 4 or 5 hours every day. At the end of the conference, the last day of the conference, he was asked, "What do you see for the future of U.S. manufacturing?" In 1992, he said, "U.S. manufacturers must get their medical costs under control or will be crippling to our industry." Now, he was looking at data running back a decade before he made this statement. He was a statistician by training, and he got into quality control in the application of statistics to solving manufacturing problems. And the U.S. government sent him to Japan to help the Japanese rebuild their industry. And of course, we all know how that turned out. They got so good at it that they were cleaning the clock of the U.S. automobile industry. It was really putting the hurt on them. The reason I bring this up is this problem that we have has taken a long time to brew. It's been getting a little worse every year and every year and every year. In 1992, he saw it as a huge problem that was going to be choking us. Obamacare kind of brought it to the spotlight, but getting rid of Obamacare is not going to solve the problem. It's deeper than that. So let's talk about what the problem is. And we've all seen this runaway cost equation. Look at the trajectory that we're currently on. Look at what it's going to do by 2019. It's devastating. It's been tracking for decades like this. There's about 4 decades of data that's been trending like this. Scary. Well, what can we do about it? Well, in the spirit of working a problem like Deming would, this is one of his favorite tools. This is a cause and effect diagram. This diagram is also known as a fishbone diagram or Ishikawa diagram. And in this diagram, we've got the key components, the key drivers and solutions to potentially address this problem. The top part of the fishbone diagram are related to the wellness of our society. Most of us realize that we have a serious health problem in America. It's lifestyle driven. And actually there's evidence today that the generation that we're raising in America today will have a shorter life expectancy than their parents. And this is scary. This is the biggest driver, but it's not the only driver. The top part of that fishbone diagram, the cause and effect diagram, you've got 2 major areas, an awareness factor, and the other thing is the willpower factor. So awareness and willpower, and we've got to work that side of the equation. The bottom part of that diagram is the marketplace dynamics. We have a problem with healthcare that's totally unique to any sector of our economy. People today know more about the cost of their eggs, if the price of eggs go up, than they do if the price of a colonoscopy goes up or any other procedure. And the problem with that, the core problem is there's a disconnect between the people that make the selection of the services and purchases to the people that are paying it. That when there's a separate party that writes the check from the people that are selecting the services, and it's a complex problem. So we'll talk more about that in a second. So let's drill down on what Cox Manufacturing did. 4 years ago, we kicked off an aggressive wellness program. So first I'm going to talk about the top part of our fishbone diagram. Let me go back to that for a second. We wanted to address the awareness and the willpower component. We decided we wanted to model a wellness program actually after our chaplain program. We had been running a chaplain program for about 3 years, and we loved the way that there were people that were counseling our staff, and we wanted to do the same thing with wellness. And there was a local hospital that was offering a wellness program, and we asked them to raise the bar on that program and do some things they had never done before. What we asked them to do was to put a nurse at our facility. We run 3 shifts, so they actually had to come once in the morning to connect with the 3rd shift and the day shift, and then once at the end of the day shift to connect with the rest of the 1st shift and the 2nd shift. So they had to come once a week to connect and coach our staff. Then the second thing they had to do was they had to put on an educational program once a month. And before we started the program, if you want to control something, you have to measure it, right? So we had to develop a metric, and here's what we used. We consulted with some doctors. We put in place biometric screenings that we would do twice a year. We now have 100% of participation. It's a voluntary program. All employees have to attend the training session, but you can't force them to let you draw their blood, right? Well, the first time we did this, one employee opted out. After she won the weight loss program, she opted in ever since, and it's been 100% participation. We give an annual bonus if the whole company moves the needle. So we've been doing this now going on the 4th year. We said from at the end of the year, at December, at Christmas time, everyone will get a $100 bonus if we've moved the company aggregate health index. So the nurses keep all the data. They coach the employees individually. The biometric screening included weight, cholesterol levels, glucose levels, HDL, LDL levels, a pretty comprehensive program. They come in and they check our employees' blood pressure, not just at the biometric screening, but when they come visit us, they'll bring the equipment they need to do blood pressure, glucose levels, that sort of thing. So we've been moving the needle at Cox Manufacturing to improve our health. They've gotten bonuses 2 out of 3, and the verdict's not in for this year. So let me show a quick video here, if we could turn that on, please. In this country, we really don't have a health care crisis, we have a health crisis, and it's a lifestyle crisis. When I look around us, we all have a problem where we're not taking care of ourselves like we should.
I'm going to have you rest your arm on the table.
In order to breed healthy changes, employees take part in biometric screenings, everything from height and weight to body mass index and cholesterol. Baptist Health System professionals make on-site visits to screen employees for common health risks, helping folks keep track of their progress. A mobile unit makes important health checks easy.
25, so this is good here.
It's week 11, you ready?
As part of a 12-week weight loss contest,
All right, Tony.
Cox employees competed on 2-man teams to see who could lose the biggest percentage of body weight.
Nice, Tony. You lost some poundage this week.
Yes!
I came out weekly for weigh-ins. Everybody was really pumped. Great teamwork. They lost an enormous amount of weight. Almost a third of the company participated, so it was really, really exciting.
At a luncheon to celebrate their success, employees ate a healthy meal and cheered on their biggest loser teams.
The Fat and the Furious.
Teams with some very creative names.
Mission Slim Possible.
A spirit of excitement spread through the room as the winners were revealed.
Woo!
And the entire company got to marvel at the amazing before and afters. The 16 teams who participated lost more than 400 pounds.
Well, $160 and $100 Academy card. Congratulations. Great job. Great example for us all.
Bill Cox says his investment in Baptist Healthy Solutions is already paying off.
It's really exceeded my expectations.
Great.
And they just have a gift for engaging with people. That's really what's made the difference. Anybody can buy a bunch of machines and put machines in a building, but it's the people that makes a difference.
Cox is a growing company, but the employees here have shrinking waistlines thanks to Baptist Healthy Solutions and a lot of determination.
Creating healthy and productive employees through workplace wellness. That's the difference.
Okay, so other things we do as part of that, we teach about, there's monthly presentations, so such things as topics of eat, move, and sleep. Great book, by the way. I learned about this book at a C12 meeting, and I highly recommend that book. The person that recommended it said it is the most impactful book he ever read outside of the Bible. So it's excellent. And our nutritionist nurses did not know about this book, but I introduced them to it, and they integrated that as part of the training. We've had a number of people quit smoking with a smoking cessation program, and I sincerely believe these programs are going to have a multi-generational impact. There's few things you could do in your company that would have such an impact as these sort of programs. Another thing we did, we took out our Coke machine and our snack machines. We've educated people, created the awareness of how unhealthy sodas are, diet soda or not, still unhealthy, and we've taken those machines out. An example, we just took out our snack machine. We have fruit, we have yogurt and carrots now in the refrigerator, bottled water. It's all part of the program. Now let's quickly talk about the second side of the cause and effect diagram. The bottom side is all about the cost, the marketplace. There's a lack of transparency in the marketplace. And what we've done with that is we've gone to an HSA program where employees have skin in the game. HSAs are great. It's something that you can carry with you into retirement. You can use it for glasses. You can use it for dental. And the best thing about it is now the employees are seeing the money they're spending. Coupled with that, what we've done is we provided employees with a third-party advisor service. We're using Compass out of Dallas. Employees can go to them and they'll get quotes from different providers. If you're, for example, a colonoscopy, you could go to them and they'll give you some options of who you can go to and what they'll charge you, and they'll give you some information on those providers' quality. So last but not least, a little tip I want to pass on to you. Our brokers, at least in our case, had been keeping their percentage at 6% per year, and as the cost of the coverage kept jumping up 10, 20, 25% per year at the same time lowering our benefits, our brokers are making more and more money every year. So we've drilled down on that. 5 to 6% seems to be the norm that they like to get away with. If you shop it, we found you could get it for 3%, but what's even better than that, you can get a fixed rate to where the broker compensation has nothing to do with what you spend. So let me pass it on to Dr. Thames.
Thanks, Bill. As Bill mentioned, the tsunami that lies before us is that we are actually staring at the first generation in U.S. history that may not live as long as the rest of us will. We're looking at potentially a 5-year loss of life expectancy over the current generation that's in their teenage and young adult years. Why is that? Because of our obesity rates and because of our diabetes rates predominantly. When I was in medical school back in the late 80s and early 90s, diabetes, type 2 diabetes, was not a diagnosis that we discussed in pediatrics. It didn't exist. And now 12 out of every 100,000 adolescents has type 2 diabetes in the United States of America. That's stunning, and that's your workforce up and coming. Just a quick aside, Toyota built a plant in San Antonio, what, about 10, 15, 12 years ago? And right at the end of closing that deal, they actually hesitated because they weren't sure that the health care and that the health of the population in San Antonio was good enough to support a workforce for their Tundra manufacturing plant. IBM is making similar decisions about where to put their plants. The data that Bill showed you early in the presentation was actual IBM data, and they use that information to decide where to go next. They look at the community health and find out, is that where we want to put our next facility? Because healthcare costs will kill us if we don't choose wisely. Just using one diagnosis as an example is diabetes. There's currently about 20 million people in the United States that have a diagnosis of type 2 diabetes, but there's probably more like 75 to 85, 20 million, I don't know what I just said there, but there's currently probably somewhere between 75 and 80 million others who are pre-diabetic, impending diabetes over the next 5 years. Just as an example, the cost of one heart attack, one non-fatal heart attack, attributed to diabetes in our San Antonio market is $49,899. If you total on loss of productivity for a 4 to 6 week recovery period after that heart attack, that cost goes up over $95,000. That's a huge amount of money for one diagnosis, for one event that is essentially preventable to a large extent. Up until now, the paradigm has been to shift those costs somewhere else. This is still, in many markets, the prevailing paradigm in healthcare. Shift those costs away. Shift them towards the patient, shift it onto the hospital system, shift it onto the employer, shift it to somewhere else. But that paradigm has not served us well. If healthcare inflation, let me back up. If food has experienced a cost inflation consistent with healthcare since World War II, we'd be paying $62 for a gallon of milk. We wouldn't tolerate that, but yet we tolerate it in our healthcare market. Part of the reason is because healthcare doesn't want to behave like most other markets. Lack of transparency is a huge issue, and Bill has given you some suggestions on how to crack that. But the other issue is healthcare is emotional, right? When you're sick, you're not actually paying all that much attention to how much you're paying. So at the end of the day, what we have to do is stop this paradigm of cost shifting and move to the second diagram, which is a paradigm of cost savings. The reason healthcare is so expensive is because we're consuming a lot of it. That's the bottom line. One thing I want to point out to you is that the way you access care in this country drives a lot of the cost that you're ultimately going to spend. As an example, if you were playing basketball this morning to stay fit and you sprained your ankle, and you went to your primary care physician, the cost of that visit to evaluate and treat your sprained ankle would be somewhere around $78. This is San Antonio market numbers that I'm presenting to you. However, if you went to the urgent care clinic down the street, that same diagnosis, rendering the same treatment, would cost you $362. And what we're dealing with in the San Antonio market is the burgeoning freestanding emergency room. If you access care for that same diagnosis, getting the same treatment rendered, that emergency room visit would cost you $974. That's greater than a tenfold increase in your cost as employers for the same diagnosis, getting the same treatment with a different portal of entry. I submit to you that one of the things you can do as business owners and leaders is educate your employee workforce about this. Educate them that it matters where they pursue care, because that will drive a significant amount of the outlay that we all end up paying in the end. Why is this important? Well, in San Antonio, as we speak, in addition to the hospitals that we now have 19 freestanding emergency rooms. And by the end of this calendar year, we will have 21. The other day, I came home from work, and I found this flyer in my mailbox. It was sitting on the table when my daughter came home from school. She's 16 at the time, now 17. Okay, she's maybe smarter than the average, but she looked at this and went, "Schedule your emergency room visit online." Dad, that's the stupidest thing I've ever heard in my life. If I could schedule my emergency room visit online, I think what I'm going to do is prevent the emergency in the first place. But I'm ashamed to tell you, as a healthcare provider and as a member of this industry, that this is what the market is doing to you. It's what it's doing to me as well. So let me give you a quick example of how we can save costs rather than shift them. We have a clinic at a facility in San Antonio that employs about 800 people. They are mechanics for airlines. They are salaried workers. $18 an hour is their average salary. One gentleman that came to see me was a 49-year-old aircraft mechanic. He has insurance, good insurance, but he's an hourly employee. So for him to go to the doctor meant that he came off the clock, he didn't get paid that day, and then he paid a $50 copay to go to the doctor. So what did he do? He didn't really go to the doctor very much. He had an associate's degree. He was not unintelligent. He was quite smart. He knew his body, he knew himself, and quite honestly, he knew something was wrong. So through our workplace wellness screening, similar to what Bill is doing at Cox Manufacturing, he was diagnosed with diabetes and hypertension. He established care at our on-site clinic. So his initial numbers, for those of you that know what a hemoglobin A1C is, you should recognize that a 12.1% is way, way out of control. For those that don't know, this is the metric that I follow to tell me if your diabetes is controlled or not. My goal is to get you below 6.5. If I keep your hemoglobin A1C below 6.5, I can dramatically reduce the risk for kidney disease, heart attack, stroke, infected feet, and need for amputation. So he's at 12.1%. His blood pressure is out of control. His cholesterol is high. Based upon these numbers, his overall heart attack risk, as I'm talking to him that day, over the next 5 years was 29%. His overall risk for a non-fatal heart attack that will cost you, remember, $49,000 was 41%. What did we do for him? Well, we spent a lot of time talking to him about nutrition. Some of you that were in the breakout session yesterday got a little bit of a flavor of how we approach that. We talked to him a lot about exercise, the importance of that. We followed him monthly in our clinic to provide for him robust primary care. He did not access an endocrinologist. He did not access a cardiologist. Everything was handled in our primary care clinic. And this particular company had recently opened a small on-site fitness facility, and he went upstairs. It happens to be right upstairs from our clinic. And he walked upstairs, and I showed him what the treadmills did, and I showed him how to do this, and he started using that facility. He was on 4 medications, unfortunately, because his diagnosis was already out of control. Those 4 medications plus his daily aspirin cost $28 per month. So what happened? His initial diagnosis with a hemoglobin A1C of 12.1% and his blood pressure and cholesterol out of control. We got him under control. In 7 months, we got his A1C down to 6.6. Which means that we reduced his risk for heart attack by tenfold. I reduced the chances. He reduced his chances. Let me say that this guy worked hard to get this under control on your behalf and his own, but he got it under control. So by reducing almost down to only 2% his risk for having that non-fatal MI, we probably saved over $45,000 over the next 5 years by keeping him out of the hospital. That's not cost shifting, that's cost savings. That took education, that took building a culture for success, and that took co-management with a primary care clinic that understood the needs of this individual. Just in closing, I'm a great student. I really have enjoyed diving deep into Joseph Grenny's book, Influencer, which really talks about this notion of putting education together with a culture that promotes success. I can educate until the cows come home, but if they are working in an environment that is not conducive to acting out the pieces of the puzzle that I'm instructing him on, we won't be successful. And the truth of the matter is, this gentleman spends more of his awake time at his employer's facility than he does anywhere else. So I'll turn it over to Dr. Ogletree.
So in 1992, I met a crazy man. His name was David Player, and he was a renal doctor. He's probably making $400,000 a year back then and treating people on dialysis. Each one of those would use about $1 million in care through Medicare and your federal government over their lifetime, which was certainly shorter than it should have been. He realized at that point this is crazy. Our country's going to go broke if we keep doing this. And so, like any smart guy would do, he started leaving his $400,000 a year job and developed a wellness program. You guys may remember that in 1985, wellness was not a big thing. If you said it back then, people wouldn't even know what you were talking about. But he had the foresight to do that, and he also was a man of faith, which was to my great advantage. So I'm 7 years into practice, family physician, about half full in a family practice, and realizing that this is crazy. This is going to kill me. I'm not going to know my kids. I'm not going to know my wife. And besides that, it's not even a great way to take care of people. And so I started looking for other ways to make a living and to serve people. And a friend of mine introduced me to Dr. Player. And so, long story short, I ended up joining him over time. And we had a weight management program, which is what Health by Design was in the beginning. And we also had an executive exam program. But there was this feeling of dissatisfaction that we're seeing the top level executives in these companies, but we're not doing much for the other 99% of their people. And at the same time, the medical infrastructure was crumbling around us and progressing towards what you see today. So we had an opportunity to do an on-site clinic at, back then, Diamond Shamrock, which was bought by Valero Energy Corporation about 6 months later. And that started our journey into providing on-site health care. And I want to show you that as a possible solution for some companies. So you guys know our health system is in disarray, right? The access is inadequate. Lots and lots of studies show that if you have great primary care, you have better results and you have lower cost. It's been known for 20, 30 years. And at the same time, they've been producing less and less primary care physicians. And now we're in a real bind because people don't have access to good care, and they don't get the time that they need. The payment system has really perverse incentives. The more, as a physician, the more you do to people, the more money you make. The more procedures they have, the more money you make. The less time you spend with them, the more money you make. Okay, they're really perverse incentives in the system. That's primarily run by the claim system. The care experience is poor, so we spend more on health care than anybody in the world, and yet if you talk to most patients, their experience is getting worse and worse in terms of being on time, having personal attention, somebody that you feel like really cared about you. So the health care experience for most of us is not all that good. As physicians and hospitals, documentation, compliance with scads of regulations are taking up probably 20% of an average physician's time that really should be spent with patients. And then there's occasionally government intervention into medicine that we could talk about for a few hours, but we're not going to. So we set about saying, how can we deliver great primary care to members of companies, to employees of companies? How can we do that? And so we said, well, what are the components of that? First off, we want to have excellent care. That goes without saying. We want a great patient experience, but we also want two other things. One, we want value for the people that are paying for this. We don't want to just do the medicine so that we can make more money. And fourthly, something you don't hear people talk about a lot, how about our doctors and nurses enjoy what they're doing? I don't know if y'all have many friends that are doctors and nurses, but most of them are not enjoying themselves very much. We're losing a lot of great practitioners, and it's due to the system. And if you don't have a happy doctor, you're probably not going to have a great experience in the exam room, okay? And we wanted that to be Christ-centered. I was a so-so Christian back when I met David Player. Have improved a lot. C12 over the last 5 years has also done that for me. But we are openly Christian in our practice and have been for a long time. So we started in 2001. We would primarily do this in self-insured companies. because they're going to pay for the care either way. If they're fully insured, it doesn't make a lot of sense, although we've had one company do that because it was so valuable to them. There are no claims. We don't send in claims and get paid that way, so we don't have that 30% overhead that you have to do for people processing your claims and begging for your money. The host company owns everything. They own all the equipment. They own all the supplies. We just work by the hour, and we manage the clinic for them. The supplies and lab cost we do on a cost-plus basis. That's important for labs because out in the real world, labs are marked up probably 80% compared to what we charge. So there's a huge markup if you go out on your health plan and get your labs done. So that's a huge savings for the host company. You have great access. You can be seen same day almost every day. Your waiting time is probably about 15 minutes. If you're sitting in the waiting room 15 minutes, we start getting nervous because these people are on the clock, and we don't want them sitting around for 2 hours waiting for a visit. We don't do occupational medicine because we feel like there's a little bit of conflict of interest. If I'm trying to be your primary care doctor and then you hurt your back and all of a sudden I'm the company doctor, that kind of doesn't make sense, right? The employees have to develop trust in you, which from the get-go is a little bit of a problem because they wonder, why is the company doing this for us and what kind of information are they sending to HR? So it takes about a year to convince them that we're truly on their side. And I tell companies, I say, I am the patient's advocate, I am not your advocate. But if we do a good job, you're going to get the benefits from this. One thing that's sorely missing in regular medicine is the time and the resources to educate people. As you know, 70% of our health problems or our health costs are due to chronic illness, right? Most chronic illness is due to our habits. Todd talked about obesity, diabetes, heart disease, all of those things you can help people with, but it takes time and it takes personal interaction with those people. So I want to show you what our results so far have been. One, you have predictable expenses, so much so that we actually charge the month ahead of time for our services. And it works out pretty well. And then we even up at the end of the month. We have about 79 to 95% participation, meaning that of all the employees in the company, they will have at least one visit. 70 to 95% of them will have at least one visit in a year. The national average for that in on-site clinics is about 30%, so we're a lot higher than that. Our return on investment is about 2 to 3 to 1. That takes into account productivity. And in terms of, you say, well, is this saving any money for companies? Those studies are very, very difficult and very expensive. I've only seen one of them ever in an on-site clinic. But I can tell you that Valero tells us that we save them about 25% on their healthcare expenses. You say, well, gosh, this is super care. This has got to cost like crazy. Well, the average visit costs about $107. And that can vary if you look at claims, not counting the copay that the patient pays. There may be $80, something like that, all the way up to $115. So it's in the range of a regular visit, and the patient pays $0. So there's no disincentive for them to come in and take care of themselves. You would think that would lead to overuse. It really doesn't. That hasn't been our experience over the past 14 years. People want to work. They don't want to come sit in the doctor's office. The cost per employee is about, for Valero for 2014, was $565 per employee. Now, would you pay $500 or $600 per employee to solidify great primary care? That includes labs, supplies, physician, nurse. We have RNs in our clinic. We have health education in our clinic. Would you pay $600 for that? I would. Are the patients satisfied? You guys are familiar with the Net Promoter Score, right? Over on the right, you see it's kind of small, but we have a big insurance company in San Antonio called USAA, who is well known for their customer service, and their Net Promoter Score is in the 80s. We did a survey of our patients, about 3,000 of them, and asked them, how satisfied are you with your patient experience at the clinic? Pretty much a Net Promoter Score. 39% of them returned their cards, and our average score was about 9.79. Our employees are happy. We regularly win Best Places to Work awards both locally and nationally. And so we feel like at this point that we've checked the boxes, that we're doing a pretty good job in all 4 areas that we really wanted to excel in. What's the future hold? Well, we need to get better at population health and documenting clinical improvement. We need to show that when we do this, we move these populations to a lot higher level of health, which will translate into long-term health care cost reductions. We would like to be able to measure the economic impact more fully. We need to integrate with specialists in hospitals because, after all, most of your expense comes from hospitalization. And so if we can find people to join us that are specialists and have the same view of value and excellence, that will help. We need to improve ways to help people with their behavioral issues in terms of eating a proper diet, exercising, keeping their weight under control, stress management, all the things that Todd talked a lot about yesterday. And we need to learn how to maintain our own culture during the growth of our company. We're spread out over 2 different states, 10 different clinics, and we do health assessments in 17 different states. And so maintaining our culture is extremely important to us and will be a challenge over time. So these are our people. I'm going to turn it back over to Bill for the wrap up.
Thank you, Dr. Ogletree. Well, as you've seen, this is a very complex problem, but don't let that intimidate you. This is a huge opportunity to minister to your employees and to be a positive influence that would have a multiple generational impact. And as a reminder, do not lose heart in doing good, for in due time we will reap if we do not grow weary. Thank you.